Well, right now we're going to take a look at COVID because our state's COVID-19 trends continue to show improvement. We've hit some big milestones, such as getting our daily number of percent positive cases down below 2%. Improving trends, that gives leaders more room to ease restrictions. We still have progress to make, of course, in the battle. But in today's To Your Wellbeing segment, we're talking trends, testing, vaccines, and then next steps with Dr. Deborah Grant, the Chief Nursing Officer for Ambulatory and Population Health for Cone Health. All right, so first and foremost, let's kind of talk about this. The past several weeks, we've seen that downward trend in the number of COVID-19 cases. Can you speak to that about what the numbers look like compared to a few months ago?
Absolutely. We are so excited to say that, a couple of months ago, we were well above 200 every single day that we would have that number of patients in our hospital with COVID. Today, we only had 12 at all of our locations. So think about that, Tanya. It's really gone down. And we see that really based on the number of vaccines people are getting. So that is all great news.
200 to 12. That is an absolute change. Okay. So as a result, testing volumes across the state, they've also decreased. So how has testing been impacted at Cone Health, and what should people know about that?
So testing has continued to go down as well. So again, what we know is if you have any symptoms out there or you've been exposed, then go ahead and get tested. We still have testing, but only about 30 to 40 a day now. There's a few days we might be at 80, but again, we're above 1,000 per day for testing. So we would say it's still the best way to find out if you have it or think you have it. You still should get tested. And you can go to any of our sites, go online. So we have the conehealth.com/testing. Just go right there because we're offering it at mobile locations and fixed locations still. So go on there and find out the best time for you to come by and get tested.
All right, well, let's talk about vaccines now because we've seen a whole lot of progress and dedication towards vaccinating the community, including some updates regarding the vaccination efforts with Cone Health. So let's talk about that, about the steps that people should follow to keep the positive movement going.
Correct. So we are so fortunate. We've had so many teams out there working in many different places, including working with the Guilford County Health Department at our Coliseum. So we still have locations, fixed locations that you can get your vaccines today. And again, those numbers are well above 1,500, and today we're only around 100 some days. So we need more people who have not gotten their vaccine. If you're over age 12, then get to the Coliseum. We will help you. We will get you your vaccine. We also have many places that are mobile now as well. So if you want to go to our site again, conehealth.com/vaccine, it will have all the different locations where you can come and get your vaccine. We're doing those mobile and we're doing those fixed. We're also even doing homebound, Tanya. So we've done 71 people in their homes. So if you have someone who's homebound and they cannot get to one of our mobile sites or to our Coliseum, then we actually have a team that can go to the home and do that. Again, those phone numbers are listed, I think, on our site that we've shared, but that's 336-890-1188. Call that. Tell us you need help even at home, and we will get a team to you because we want to care for our community wherever they are. So we're trying to reach them wherever they are. So no shot, you need to step up and get it done right now so we can move on.
And we certainly have seen the progression. Of course, when the vaccines first came out, we had calls from people saying, what do in-homebound people do? And at that time, it was kind of like, well, right now we're just trying to concentrate on as many folks as possible and getting it out. But now we're at the point where we can service all of the folks.
And we're also going to be offering it at our local physicians' offices. Some have already started that, so you can call your office to your primary care physician office. We'll continue to do that as well. But if you have any of those questions, just call our number and we'll definitely get them connected to get their vaccine.
All right, before we wrap up this first part and we go to the viewer questions, is there anything else that you think people should know or keep top of mind?
I think talk to anyone if you've got a question. If you're feeling just a little unsure, just talk to anybody that's already had their vaccine or talk to your physician, talk to your clinical staff. They will help you to help make that decision. So anybody with a question, give us a call or give your provider a call.
Okay. All right. So what we're going to do is we're going to wrap up this segment right here. But what we're going to do next is move on to your questions. So that means that you get to text in your questions to our expert. That number is 336 888-379-5775. Remember, this is a text only, so don't call, but we do want to get your questions answered. Coming up in the next segment, we'll be right back.